So this toe walker patient of mine is a 7-year-old young girl. She went to therapy and there was no results. They couldn't make any progress with her, so her doctor referred her to me, and she has toe walking level 2, hypertonia in calf muscles and hamstrings muscles. And with her, we right away injected Botox. We had 400 units of Botox. We put 200 units into left calf muscles, 200 units in right calf muscle. So of course we worked with her, performing the treatment. The second Botox injections, we went into hamstrings. We put 200 units in her hamstrings, left hamstring muscles, and 200 units in her right hamstrings muscles. And then the next third round of Botox, we put 200 units into left calf, 200 units into right calf muscle. And then the fourth round was, we put 100 units in right calf, 100 units in the left calf, and then 100 units into each hamstring muscles. And within a year, she recovered beautifully, and you're going to see her video now when it was taken when she was 13 years old. Because when she came to me, she was 7 years old. It took 1 year. I recorded her at the time of evaluation on discharge, but accidentally I erased the videos. So I asked the parents to send me the videos of her walking when she was walking on the first day of school to her class, and then they videotaped her walking now 5 years after rehab, and you can see a beautiful recovery, really easy. So let's take a look. And now she's 13 years old, 5 years after rehab, and a beautiful recovery, normal gait pattern. The next toe walker is a grandson of a friend of mine who mentioned to me that his grandson is walking on toes. And he's 7 years old, and my friend said, "Can you do something about it?" I said, "Absolutely." So we're going to fix this problem. So he came for evaluation, and I have a short video of him walking in the office, and you can see he is a toe walking level 2. He's very high on his toes, but fortunately it's a very mild hypertonia, and it's easy to break it down because it's soft, it's not very dense. So he's already making phenomenal improvement. Just 7 visits and he is doing great. But we need to use Botox because if we don't, I don't want to have him come to therapy for months. We can accelerate the progress really fast if we use Botox. So his doctor is ordering Botox, and as soon as we get the Botox, we're going to inject. We're going to have 400 units. We're going to put probably 150 into left calf muscle, 150 into right calf muscle, and we put probably 50 units into left hamstrings and 50 units into right hamstrings. He has a little bit of hypertonia in his thoracolumbar area on the right side, but it's very mild. His trunk range of motion is fine, is very flexible, but I need to remove that hypertonia, because if I don't decrease it, then later in life he will have problems with his back. He may have some back pain in that affected area. So we need to use the Botox. It will accelerate the progress. So I've seen him a couple of times, about 7 times, and he's already walking very well. Of course, he still gets up on his toes because it is still a habit. So once we break down that hypertonia with Botox and work with him, he will do fine. He will never again walk on his toes. So I have a video when I evaluated him on the first day, and then you're going to see video of him walking when he is after the 7th visit, and the progress is great. I will be recording his treatment for parents, for doctors, for physical therapists, occupational therapists, to view the progress as it happens. I will make comment about his recovery. So we'll take a look at his video now.
Okay, yeah, do you like that machine? What do you think? You want to work out?
I don't know. If you only told me the rules.
Wow, beautiful. Look at this. He's pulling up his toes, strikes with the heel. Beautiful. Yep. How does it feel, Benton?
Good.
Good? Yeah, it's going to take a little time to learn to walk normally. It's kind of, we have to break that habit. It's beautiful progress, just a drive-through progress. I'm shocked how quickly. Keep going, bud, keep going. How quickly we're making the progress here. Essentially from treatment to treatment. No surgery needed. We do not do surgery on 6-year-old children, 5, 6 years old children, because it's not necessary. We just have to restore normal gait pattern, which is very easy.
So this patient, this is the worst case of hypertonia, which causes toe walking. It's a level 3, so calf muscles, hamstrings, and trunk. And here I'm testing him. I'm asking him to perform a squat. So you can see he cannot put his heels down. He's tippy-toeing when he does a squat, and he's very unstable. And you see what the effect of the hypertonia is on range of motion. He cannot perform normal squat. Here I ask him to do some dribbling, and you can see him walking. And then I'm going to ask him to sit down on the floor and show you what happens if you delay the treatment. If I had him when he was a year old, year and a half, then the rehab would have been much faster, probably 6 months, and that would be it. But because they waited 10 years, he already has heel cord contractures and soft tissue contractures. And look at the range of motion in his trunk. I'm asking him to touch his toes. Look at the position of his trunk in relation to his legs. It's 90 degrees. That's how stiff it is. This is rigidity caused by soft tissue contractures, not only hypertonia. So remember, it's imperative that you start the rehabilitation of toe walkers right away. When they start to walk and walk on their toes, immediately go to therapy. And we're going to show you his progress video. There he is, a year and a half into rehab, normal gait pattern. And we continued rehabilitation because to this point, I broke down the hypertonia in his calf muscles and hamstrings, but he had a lot of the rigidity and soft tissue contractures in his back muscles. So we continued rehab and Botox treatment to break down the hypertonia and that rigidity. So he's doing very well now, no more problems. And I have a video of him which will attach to this one. When he's 20 years old, he stopped by to say hello to us. And now you can see one of my patients, he's already 19 years old and has normal gait pattern. That's the worst case of toe walking I ever treated. And beautiful recovery. So this is a 7-year-old boy. He is a toe walker. Level of toe walking and hypertonia is 2 calf muscles and hamstrings. And he was my first patient. I did not use Botox. I just used the treatment. And it took me about 7 months to correct this problem. And I was very lucky because the hypertonia was of low density, so it was easy to break down. And now you can see his video progress, and you can see him nice heel to toe, no more toe walking. So this is another patient, but he is only 15, 16 months old. And this is
Second treatment, when he came to me for evaluation, his toes were curled under. He was walking on the knuckles of his toes. One treatment and we straighten out the feet. So the toes are straight now. He is tippy-toeing, but with help. He is still not able to walk. And it took me only 3 to 4 months to correct that hypertonia. And when you start the therapy right away, which is imperative, we have to start the rehab right away. The moment the kids begin to walk and they get up on their toes, do not wait. That's the worst thing you can do. Do not wait, because if you treat the children right away, the hypertonia is very soft, there is no soft tissue contractures, and it's very easy to correct this problem.
So here we have the progress video from his last visit. This was the discharge time. 4 months later, beautiful normal gait pattern, good balance, and nice recovery. And this is how you do it.